So I would love to talk to you about gender responsive approaches in drug policy and treatment, and more concrete, the Pederson's continuum of approaches. So what we see in the literature and in health is that gender inequity is a global challenge to health equity. The last decades, gender is being recognized as a social determinant of health. It's a dynamic construct of health. And historically, work on gender has focused on women. So although the status of women and conditions for gender equality have improved the latest years in high, medium, and low income countries, increasingly even, still women and girls remain disadvantaged relative to men in various ways. So in response to recognizing these disadvantages and this discrimination, it's been seen as a violation of human rights and a barrier to broader social development. So also, it's acknowledged that social, economic, and political structures and institutions tend to marginalize women. And what they also do is they perpetuate images of and ideals for men. And these stereotypes, the images and ideals that they perpetuate, they cause pressure and stress among men. So in response to these marginalization, discrimination, and these stereotypes, the field of gender and gender mainstreaming has entered the international policy in health. And in doing so, it's recognized that an individual focus on women without a long-term vision yields limited results. So we must pay attention to how men can contribute to improving gender relations. And that's been in health since the 90s. So in some way, we could say that gender mainstreaming addresses women's specific health needs, but it is about men and women. So the World Health Organization has developed a gender responsive assessment scale, and it consists of 5, I'm not sure if it's clear, the image, but it consists of 5 degrees or levels of gender responsiveness. It has been developed in 2011, and it says that a gender responsive policy or program must fulfill 2 basic criteria. And these basic criteria is it must consider gender norms, roles, and relations. And second, it must take active measures to reduce harmful effects of gender roles, norms, and relations. So we know that every program, every policy uses or acknowledges gender norms and roles and relations in a very particular way. And if we want to assess how they can reduce the harmful effects of stereotypes, then we need to use this gender responsive assessment scale. So if we look at all these different stages or levels or degrees very specifically, we see that the first 2 levels, gender unequal and gender blind, these are levels we have to avoid at all costs. So the gender unequal level perpetuates gender inequality by reinforcing unbalanced norms, roles, and relationships. So we see that they tend to benefit one sex over another. So it privileges men over women, or vice versa, women over men. And it often leads to one sex enjoying more rights or opportunities than the other. The second level, the gender blind level, it still ignores gender norms, roles, and relations. So it very, very often reinforces gender-based discrimination. It ignores differences in opportunities and resource allocation for women and for men. And this approach is often based, or these strategies or interventions are often based on the principle of it's fair because we're treating everyone the same. So we have to try to avoid these 2 strategies. The third one, the gender sensitive, it's the middle one, and it's kind of like a turning point, a starting point towards gender responsive approaches. So this one considers gender norms, roles, and relations, but it does not address inequality. So it kind of indicates a gender awareness, but it doesn't address inequality generated by unequal norms, roles, and relationships. So there is often no immediate or remedial action developed. But this is a crucial step towards gender responsive strategies and interventions. So we need this one, but we want more. We don't want to stay here. The fourth and the fifth, gender specific and gender transformative, that's what we're heading at. That's what we're aiming at. So gender specific considers gender norms, roles, and relations for women and for men and how they affect access to and control over resources. So it considers the needs of women, the specific needs of women and of men. And it intentionally targets and benefits a specific group of women or men to achieve certain policy or program goals or meet their certain needs. So what does gender specific do? It makes it easier for women and men to fulfill certain duties that are ascribed to them based on their gender roles. The last one, gender transformative. It also considers gender norms, roles, and relations for women and men. It also considers their specific needs. But what does it do next to that? It addresses the causes of gender-based health inequities, and it includes ways to transform harmful gender norms. So it doesn't only consider the needs and consider the gender norms, but it also addresses the causes and includes ways to transform them. So the objective here is to promote gender equality. So it includes strategies to foster progressive changes, empower relationships between women and men. So in sum, what can we say? The first two, gender unequal and gender blind, I've already told you so, we should avoid at all costs because they ignore the importance of gender and they reinforce discrimination. The middle one, gender sensitive, is a first step towards gender responsive approach. It's a good, crucial first step, but we want more. So public health practitioners have to aim for gender specific and gender transformative approaches, and these are complementary. They are complementary progressive steps towards gender mainstreaming. Why are they complementary? In public health, we want long-term goals and we want short-term or medium-term goals. And the gender transformative approach or intervention has a long-term goal. It also has meaningful participation as an essential ingredient to achieve sustainable outcomes. So these are the long-term goals, and we have to supplement them or add short and medium-term goals, and these have to be gender-specific. So these are very specific for the needs of women at this time. Okay, so gender inequity is a pervasive global challenge to health equity and to the drug addiction field. Now, if we dive into the drug addiction field, we see that the influence of gender, for example, on epidemiology of substance use. Wouter has already spoken about this, so men clearly outnumber women in alcohol and drug treatment services. Thank you. Women also tend to enter treatment because of problems with alcohol and stimulant drugs. We also see that there is an influence of gender on the diverse pathways into treatment. So men and women have different pathways into treatment. Women tend to have more severe substance problems at treatment entry. For example, there's also an influence on gender on the clinical and service need profiles. So women tend to have specific needs when they are in treatments. And last but not least, there is an influence of gender on factors related to treatment retention and outcome, as Wouter has already said. So gender has an influence on substance use, on the drug addiction field, on different aspects of this topic. So in response to that, Pederson, Lorraine Greaves, and Nancy Poole, they have been looking at the World Health Organization's GRASS, the Gender Responsive Assessment Scale, and at these influence of gender in the substance use field. And they've made or developed a continuum of approaches to action on gender and health. So they've used the World Health Graph, and they have added the below line, thank you, the below line, in that they say that strategies or intervention or programs can exploit, accommodate, or transform gender roles, gender norms, or gender relations in the way that they frame an issue, in the way that they use language or imagery, in the way that they use gender equity or gender inequity. So these women, these researchers, they say that the gender transformative approach consists of 4 core principles. A gender transformative approach needs to be women-centered, it needs to be harm-reducing, trauma-informed, and strengths-based. So if we have a look at what does it mean women-centered, for example, it means that this approach or this intervention must empower women, and it must consider women as an active agent of change in her life. What does that mean, harm-reducing? Interventions in harm-reducing, they provide pragmatic support in helping with immediate goals and providing a variety of options and support. They don't only focus on narrow goals related to change in a very specific health behavior, but they also facilitate change in the full range of influences and harms associated with one very specific behavior. So it's about broadening the scope, and it's about looking further than one problematic behavior. So women-centered, harm-reducing, it's also trauma-informed. What does that mean? It has to be about reparative and trustworthy relationships if we want to achieve change. And it's also strengths-based. It's focused on restoring and building health rather than identifying women's shortcomings. So these 4 core principles are important, but there are also some additional points that are important when we want to achieve health equity and gender equity. For example, integrated, diversified programs are important if we want to achieve behavior change. So what is that? Integrated, diversified programs? It's a combination of at least 2 different types of activities. These activities reinforce one another and address issues from multiple perspectives. So in this way, we want to reach multiple actors on a certain topic. So we see that multi-issue programs show a greater effectiveness than single-issue interventions. A few examples of these actions are, for example, a mass media campaign involving soap opera or theater or a play to raise community awareness. It can also be provision of healthcare services, like, for example, condoms or needles. It's a one-on-one counseling. It's educational and informational materials, or a camp, a weekly camp to inform and develop peers, and the distribution of materials to target health providers. So integrated diversified programs is about at least 2 different types of these activities. Then a next point that is very important in gender transformative approach, if we want to achieve behavior change, is multisectoral action. So interventions, we need interventions that reach beyond the health sector. So for example, this is about collaboration with religious or cultural leaders or services. It's about collaboration with schools, with healthcare providers, and for example, with community activists. So multi-sector, different sectors are involved in the intervention or the program. But also it needs to be multi-level, multi-stakeholder involvement. What does that mean? It means that the participation of different stakeholders at different levels of the social ecological model need to be involved. So involving key figures at the micro, meso, exo, and macro level. For example, individuals and leaders from the community, the government, civil society, NGOs, etc. So what we see is that individual-focused interventions are crucial. We need to empower women, we need to empower men, but targeting societal structures is equally essential if we want to achieve behavior change. So it needs to be a little bit of both individual focus and societal structures. And then last but not least, it's about men and women. So if we want change among women, then we need to involve men. I know that this is a very delicate topic because often in the drug addiction field, it's about disrupted power dynamics in relationships between men and women. It's about a violation of trust, sexual abuse, etc. So it's important that if we involve men, that we have to do that in respect to a woman's feeling safe and a woman's sense of safety and trust. To say in the words of a woman in recovery, I'll have to live with men once I'm back outside. So I better learn how to do that in a healthy way here between these safe walls. And one service provider said, we need to see men as partners in women's health, because if we don't involve them, nothing will ever change. So then the study that we did in, I think a few years ago already, we looked at the treatment provider's perspective on a responsive approach, gender-responsive approach in the alcohol and drug treatment for women in Belgium. And I would like to share with you very shortly the results, the study findings we had for this study. First of all, treatment providers said that it's important to have a gender-responsive policy in your treatment or in your program. So service policy on what is gender responsiveness? How do we want, what do we see as gender responsiveness within our program? It's also a gender-responsive way of thinking, not only of practitioners, not only of counselors, but also of people in the kitchen or cleaning people. So it's a gender-responsive way of thinking of everyone in the program or the intervention. What does that also consist of? Training and exchange of expertise. There is a lack of training and there is a lack of knowledge on how to engage with women in treatment. So these people say we need training, we need exchange of expertise, of good practices. Second study finding was concerned mother and children in treatment. So these treatment providers said that a child-friendly environment or setting is very important for women to enter treatment. They also said that there is a lack of treatment options for substance-using mothers and their children, and that there is a lack of a detox department for mothers and their children only. So detox is mostly mixed gender with men, but they also said that it could be valuable to have one for mothers only. They also said that a multisectoral action for mothers with children is very important. There needs to be attention for nurseries for their children, for parenthood issues, for gynecologist appointments, etc. A third important aspect was the accessibility of care. So there need to be alternative, innovative services that are friendly to a woman's life, friendly to a mother's life, that is flexible, for example, like a self-help group, like a helpline available during daytime, but also at night. And of course, very important, the financial reimbursement. It's very important for women as well. They are financially less able to pay for a gynecologist or a dentist or a health practitioner. So financial reimbursements are important as well. The next one is trauma-informed approach. So we need to, these service providers, they say that we have to map specific needs from the start when a woman enters treatment. So we have to see, okay, what are her needs and what are her specific goals? It also needs to be a combination of single gender and mixed gender approaches in treatment. So we have to see where is this woman in her treatment trajectory and how do we want to help her? Does she need a single gender approach, or does she need a mixed gender, or can we combine both? Another important aspect is the empowerment, of course, and how can we empower women by using psychoeducational seminars and training on, for example, assertiveness, or on how to take care of yourself. Also important is a holistic approach. So providers say that it's important for women to get to know their body again, to respect their body again, and to do that not only by talking and by general therapy, but also by a body therapy, like, for example, yoga. What was also important, building networks and support systems around women. Not only professional networks, but also private networks. And of course, the involvement of experts by experience was also pointed as very essential. And then one of the last ones was awareness raising campaigns. So not only prevention campaigns, but also awareness raising campaigns. And the providers identified several types of prevention campaigns for the general population, trying to reduce the stigma on women and substance use, but also for professionals. Also for the stigma, reducing the stigma, but also pointing out that women using substances have specific needs. Prevention campaigns for women who use drugs, having a harm-reducing perspective, for example, using contraception or how to use safe needles, etc. And then a fourth target group, let's say, is treatment centers itself. So prevention campaigns, awareness campaigns must be in treatment centers itself, involving men as well as women. And then a last important aspect that treatment providers identified was, what about men in the narrative? What is their position? How can we involve them so that it's still safe for women to be in treatment? So men need to be involved and addressed as much as women regarding, of course, the safety of women. So they need to be involved in prevention and awareness raising campaigns. They need to be involved in the use of contraception and in family planning. They need to be involved in psychoeducational seminars. So as you can see, the study findings are partly gender-specific approaches, are partly gender-transformative approaches. But what can we see in the international literature? That there is a lack of literature on gender, that there is a lack of research on gender, on gender-transformative approach. We need more studies. So what do we need? We need to see what are the effects of gender transformative and gender specific approaches. The evidence that there is now is limited to certain health areas, such as, for example, sexual and reproductive health or HIV/AIDS. But there is a need to transfer lessons learned in these areas to other areas of health. And of course, among all types of gender identities, as Wouter also said. So messages to take home: gender transformative interventions are women-centered, harm-reducing, they are strengths-based and trauma-informed, they are integrated and diversified programs, and they involve men and women. And finally, how do you think drug-related programs and interventions in your country can be assessed using the gender assessment scale? Are they gender unequal, blind, sensitive, specific, or transformative? Thank you for your attention.